Dr. N. Jeya Sankar. He's practicing in Chennai. So, sir, myself Sandeep, and I am from Jharkhand basically. So, we are welcoming you on our group. So, sir,
Thank you.
please tell me something about yourself, and then about some clinical note we will see.
Sure, sir. I am Dr. N. Jaishankar. I am postgraduate in Siddha medicine. That is one among the system of in the system of medicine, Siddha, Ayurveda, and Unani homeopathy. I come to Siddha group. I completed my PG in 1994, and thereafter I am practicing Siddha. From 2000 onwards, I am practicing acupuncture. Almost 22 years in Pondicherry and not in Chennai, as you said in the
Oh, I'm sorry,
previously.
sir.
No, not an issue. I am from Pondicherry. I am born and brought up in Pondicherry and practicing only external therapy mostly. Although I am a medical doctor, so I rarely prescribe medication. I rely on our own system, Varmam. So it comes under Siddha system, Varmam, acupuncture. These are the two main. And another one is an extension of Varmam is called Suttigai. So generally it is called cautery. So I'm expertising in cautery treatment. It is also coming under acupuncture cautery, but it is less known to the acupuncturist because it has become extinct almost 50 years. So I am reviving acupuncture cautery and also Suttigai cautery. This is metal cautery.
Okay. So, sir, I am showing you some of the slides which you have sent to me. So, please explain to our viewers about the low back pain and the, I think, heel pain, right? So,
Yes.
there is a slide to this.
So,
Is it visible to you, sir?
yes, sir. Yes. It remove.
So, this is about the
Clarity.
qualification of the sir.
Yes. Before going to the subject, first of all, a smile afternoon to everyone. I would like to extend my warm greetings and thanks to Sandeep Goyal, sir, for giving me an opportunity to share my clinical experience in the management of low back pain and heel pain through acupuncture. To be frank, Sandeep sir and myself had not neither met in person nor through phone for all these days. So we did connect each other through Telegram acupuncture knowledge sharing groups. So I had delivered many lectures and conducted many workshops in various platforms, such as for Siddha doctors and students, nursing students, and B.Pharm students. But this is the first time I am delivering my lecture exclusively for acupuncturists. For this, I wish to I wish to extend my thanks to Sandeep Goyal sir. Thank you very much, sir. So
Thank you,
let
sir.
me start. Thank you, sir. So let me go into the subject. Before going into the subject, so I would like to say something about my portfolio. Uh, as I said earlier, I completed MD Siddha in 1994 and PGD PPSC from Apollo Hospital, Hyderabad in the year 2000. I was the former consultant for Siddha Regional Research Institute, Pondicherry. Presently, I am GB member for the National Institute of Siddha, Tambaram, and also I am the director and coach for the Sai Acupuncture Educational Institute, which is a part of Gopalakrishna Memorial Trust. This something about my personal portfolio. So I come directly into the subject. So low back pain and heel pain through acupuncture. So although so many systems are there, Sujok, Sujok acupuncture, Master Tang's acupuncture, Richard Tan acupuncture, ear acupuncture, then abdominal acupuncture. So I was introduced to Sujok acupuncture in the year 2000 by Dr. Shankar K. Mogana Selvan from Chennai. He's a qualified MBBS doctor, and only through him I learned acupuncture. Firstly, Sujok, and then I have shifted my base to TCM and other forms of acupuncture. Even now, Sujok is my first line of treatment. Then only it comes auricular acupuncture, then scalp acupuncture, etc. So as Sandeep Goyal said or asked me to something to narrate on scalp acupuncture and tongue acupuncture, I have given importance in this session. These points covering for the low back pain and heel pain. Firstly, let me come to the low back pain. So here you can see four diagrams and also one table in the screen. So it is YNSA. I have mentioned this as YNSA. YNSA is nothing but Yamamoto New Scalp Acupuncture Points. Okay, there are
Okay.
many acupuncture. Zoo scalp acupuncture is also one among the best form of scalp acupuncture. Now I entered in this session only YNSA points.
Mm.
These four figures, both the frontal side and also long, lateral side, I have shown this. As you are
Mm.
aware, as an acupuncturist, yin and yang is the basic complement of acupuncture.
Mm.
In scalp acupuncture or in YNSA acupuncture also, we can see yin and yang side. So front is yin and back is yang. Left is yang, right is yin. So it is divided by coronal line and sagittal line. So you can see the in this diagram in YSNA, there is Yamamoto no scalp acupuncture. The
Mm.
master has dealt with four types of points, mainly basic points, sensory
Mm.
points, epsilon points, and
Mm.
brain points. Now
Mm.
I am detailing about basic points. I have left out the sensory points, epsilon points, and brain points. So
Mm.
there are 9 points, basic points as per YNSA. That is informed like A, B, C, D, E, F, G, H, I.
Mm.
Out of
Mm.
A, I, we are going to mention about only D, H, I, and F. Why
Mm.
this only these 4 points? Because this D point, H point, I point, and F point alone is meant for mostly low back pain and heel pain. So
Mm.
first of all, D point. Let me tell where is the location. So I assume that since all the listeners are acupuncturists, I'm not going to detail in the location of the points. Directly coming to the point, it is located in the sides of the ear.
Mm.
Okay, the zygomatic arch is there, and to just posteriorly. So this is the point you can select for low back pain.
Mm.
Before that, before inserting the needle, first of all,
Mm.
you just, with the help of your thumb, you press the points on both the ears, right
Mm.
and left. Ask the patient whether they feel tenderness over the point where we have given pressure.
Mm.
In OSNA, the points are selected on the same side. Whereas in
Mm.
tongue, it is ipsilateral or contralateral. Mostly in YSNA, we select the points on the same side of the where the problem is arising. So if there
Mm.
is pain on the right side, right low back pain, you just
Mm.
press on the right side. If there is tenderness, you can insert the needle, one shoe
Mm.
needle. If the patient doesn't show any sense of tenderness,
Mm.
or if there is tenderness and also at the same time if they feel the pain less in the low back, then you have selected the correct point and you can insert the needle as it is. If there
Okay.
is no tenderness and also there is no pain, there is no pain felt by the patient, you can switch on the left ear and you give
Mm.
mild to moderate pressure. If he
Mm.
says there is tenderness and also if there is somewhat a reduction in the amount of pain in the right low back, you
Mm.
can select left side point than the right point. Okay, this is the
Okay.
basic one. So don't go into the book theory. You just of all you verify whether with the thumb or
Mm.
by any means, whether you can select it by the means of Jimmy or else. But this, for YNSA, thumb pressure or middle finger pressure will be good. This is the
Okay.
one form of selecting the points. For
Mm.
you needle it, and after 15 minutes you can lift it and you can pull, you can push it. So the
Mm.
for according to book literature, for
Mm.
every 10 minutes you have to give the movements to the needles. But in my
Mm.
practice, so I retain the needle for 30 minutes. In that 30 minutes, in about 15 to 20 minutes, I will pull and push the needle in the mild to moderate pressure.
Mm-hmm.
This is one thing. So after going to the D point, you can select H and E point, H and I point. H
Mm.
and I point is nothing but extra lumbar points or complementary points.
Mm.
You may not use this H point or I point without using the D point, as the name is complementary. For
Mm.
example, if you are going to a five-star hotel, you are taking a
Mm.
room. For that room, you are given breakfast as a complimentary
Right.
because you have taken the room. Breakfast is complimentary, but only if you have taken complimentary breakfast, you may not be provided hotel room. So that is the
Mm.
same case here.
Mm.
You have to select H and I point after needling D point. Mere
Mm.
putting needle in H and I point alone may not give
Mm.
you much results. So you
Okay.
select D point, then H point, and I
Mm.
point. These are the
Mm.
three basic points for low back pain. Okay.
Mm.
So low back pain, there are many causes. It might be due to sciatica also. So in
Mm.
this case, you can select if you are confirmed that the patient is suffering from sciatica. So you can
Mm.
select F point. But these D point, H point, and I point, and I
Mm.
point might be useful for sciatica also. But
Mm.
in addition to D, H, and I point, you
Mm.
can needle the F point, which is situated in the mastoid process.
Mm.
There is only one point. The F point is the indication is only for sciatica,
Mm.
whereas D,
Mm.
H, and I points are can be used for any low back pain, including
Mm.
thigh pain, knee pain, ankle pain, or toes pain. This is
Mm.
the dictum. Okay, so I have marked here D point, H point, and I point. Finally, F point. F point only for sciatica and not for anything else. Next slide,
Mm.
please. Next slide. So previously I have said that is used in YSNA. So another one is Master Tung's point. This is also very, very, very effective points for low back pain, which I practice in my clinic. So there are five points you can select. The 3 points on the right side and the 2 points on the left hand. What are all the
Mm.
3 points on the right hand? Lingu, Dabar, and Zonki. These are all the 3 points which I use in my practice. And Master M.K. Sastriji also is very much interested in using these 3 points, mainly Lingu and Daba. So Lingu is nothing but the meeting point of the first finger and the second finger. That's first and metacarpal. That is the Lingu. So you can
Mm.
feel it. If there is a depression, you select
Mm.
this point Lingu,
Mm.
and you can select zone key. Zone key is nothing but in traditional acupuncture, it is L3.
Mm.
L3, that is head of the is proximal to the head of the metacarpal.
Mm.
In between zone key and lingu, it is called daba.
Mm.
So these 3 points are mainly intended for low back pain.
Mm.
Almost
Mm.
immediately you can see the result. You
Mm.
have to push and pull the needles. So
Mm.
you can ask the patient for any disease sensation. If there is disease sensation, your point of selection is absolutely correct. Or else you can adjust in such a way patient feels the pain.
Mm.
Daba and lingu is not only for low back pain, it may be used for many chronic disease as per Master Tang's words. Any
Mm.
chronic disease, even though if you are not aware of the name of the disease and you could not diagnose the disease pathology or physiology, you may insert these 3 points: lingu, dabai, and zonki. So for a chronic disease, means low back pain, heel pain, seizures, then in a female delayed labor, dysmenorrhea, and any symptom, you can select this point. Next,
Mm.
after giving these points, I will go on for another set of points by on the left hand, Zong boy and Zia boy. Ba
Mm.
is nothing but is called white. Zong is middle, and Zia is I mean Zong is central, and Zia is lower. So lower white
Mm.
and middle white is called. Daba is called greater white. Okay.
Mm.
So I will select these point Zong boy and Zia boy. Why? This is called the kidney reaction area. Okay.
Mm.
So almost kidney reaction for any as per acupuncture. So kidney and urinary bladder meridians are intended for the main meridians involved in the low back pain. Anybody who is
Mm.
having low back pain or soreness in the low back, or any weakness, or any tinnitus, or deafness, there might be weakness in the kidney meridian. As per
Mm.
Dr. Master Tang, these 2 points are located in the kidney reaction areas.
Mm.
Zong Zongbai and Xiaobai does a very good gives very good results in kidney deficiency disorders or
Mm.
kidney vacuity disorders. So almost you can select for low back pain as per YNSA name, point number D, point number H, point number I, and point number
Mm.
F. Apart from this,
Mm.
you can select from to most times acupuncture, Lingu, Dabai, Zonki,
Mm.
also Zongbai and Ziabai.
Mm.
What I have mentioned is only some of the points. There are still more points in other, say, auricular acupuncture, or abdominal acupuncture, or Richard Tan's acupuncture, or
Mm.
Sujok acupuncture. You may not
Mm.
you need not to use all the points what I have said. They said now you select the points according to the nature of the disease and also the constitution of the patient. If they are, if the patients are well enough, showed good response by giving D, H, and I, yeah, yeah, F point, you need not select this point. So you can
Mm.
limit your points. If at all the patient does not give you results, you can select some more points. What I have said now. Okay. So next
Mm.
we can go for the heel pain. I am going here mainly Master Tang's point and also Sujok acupuncture for heel pain. Um, D point, H point, I point, and F point. As you are aware and as you know, this is for lower back pain, for lower extremities. Since heel pain belongs to lower extremity, these 4 points also might be used to treat for heel pain. Okay, I am
Mm.
not repeating those points here. You may select and you can go this. Here in the hand, I have shown 3 points. This is called three passes by Master Tongue. There are many phases, many zones as per the Master Tongue. 11.01, 12.02, like this, many phases of points. These comes under second 22 phase. So many in the fingers alone, in the palm and dorsum, then anterior arm, so lower arm, the thigh, leg, ankle. There are many zones or phases. In this is second phase of the master tongue's points. In that, this is called three passes. Three passes. This is Dawama group. So master tongue has given detailed explanation for each and everything in the advanced tongue style acupuncture. It mainly deals with Dawama points, where 3 points, 3 sets of points is used to treat many diseases. So he has segregated the liver reaction area, lung reaction area, spleen reaction area, kidney reaction area, lung and large intestine area, etc. These 3 points or three passes comes under kidney reaction area or urinary bladder reaction area.
Mm.
He starts with the kidney meridian. So kidney
Mm.
meridian and urinary bladder meridian both are interiorly or exteriorly related to each other. So hence they are selecting the points of the urinary bladder meridian. One thing through meridian wise. Now, Master Tang is also expert in the holographic acupuncture. According to him, these 3 points comes under or it related to heat. So he selected in such a way, these 3 points are very good for heel pain. I also select these points for heel pain. Firstly, I will put a needle in the center point, then on the radial side, and I will put the needle on the lateral side. These 3 points, that's distal to point 0.5 shown, distal to the anterior transverse wrist crease. Okay,
Mm.
these are very good points. As I said previously, you have to insert the needle. After 10 to 15 minutes, you have to pull and push the needle in such a way. You have to ask the patient whether there is reduction in the heel pain. Next
Mm.
slide. Next slide, please. The second point. So it is in the finger. So this is in the first zone. These 5 points are together called five tigers. Where is it? Is it these five tigers is located on the so dark and light skin, the adjacent area. This is a meeting point of the dark and light skin.
Mm.
These
Mm.
three on the even it is evenly distributed, two fin distributors, and you have to select the center point. From then onwards, you have to select proximal and distal. Each is two fin distal, two fin measurement. Okay.
Mm.
In this, according to Master Tang, you should not use all the points together. You may select 3 points according to the tenderness, where you put a jimmy on the area, and you have to mild pressure. You ask the patient whether there is tenderness, then you can put the needle. But in general, I will select the point. First of all, I will put the needle on the center point and
Mm.
fifth point, then first point. So
Mm.
third point, fifth point, first point. So first point is the that towards the nail, and the fifth point is towards the metacarpal phalangeal joint, first
Mm.
joint.
Mm.
Usually, insert needle in the third point, then fifth point, and first point.
Mm.
These give very good result.
Mm.
And another one thing is, if the patient is having right side heel pain, you have to select on the left thumb.
Mm.
And if the patient have pain on the left heel, you have to select the patient's right thumb. If
Mm.
both the heels are pain, you can select both the thumb and you can put needle. This is ipsilateral, contralateral. These are the basic terminologies used by master tongue. If there is
Mm.
both set, you can select both the thumb, or else contralateral thumb you can select. This also gives very good result for heel pain. Next
Mm.
slide, please. So finally, this point I admire most in my clinic, and I advocate this point. This is the foremost point I give to my patients. So immediate result will be there. This is the point told by Professor Park Jae Woo. This comes under primary correspondence. There are major correspondence systems: primary correspondence, secondary
Mm.
correspondence, then mini correspondence, micro correspondence. Likewise, we can segregate in the holographic theory. In this, I have selected, or I will select initially primary. Primary means for the left side heel pain, I will select the left middle finger, last phalanx, lost phalanx. And for the right side heel pain, I will select the right middle finger and lost phalanx. Okay.
Mm.
In some cases, there may not be tenderness on the same side. So in that case, I will select the secondary correspondence points. If they feel tenderness on the secondary point, I will select and put the needle. Only switch off needle here. So
Mm.
it gives immediate results.
Mm.
Either you can select YSNA points for heel pain, or else you can select three passes. The
Mm.
third one is five tigers point, and fourth one is Sujok primary correspondence points or
Mm.
secondary correspondence points. But out of all these, I get immediate results in these primary and secondary correspondence points. These are all
Mm.
something I adapt in my clinical practice. Although there are many points in distally, we can give many points. ST36, GB34, ST from 40,
Mm.
liver, and there are many points. But to summarize, so for this part of this session, I have limited my points. Don't think
Mm.
only these points might be given. There's still lot points are there in acupuncture, which gives tremendous results. You may not think of acupuncture by it does wonders. It gives magic in my
Mm.
practice. So patients are very well adapted to my way of practice, and they happily come to me for pain. So in my clinic, most of the patients are coming for pain management. Next, infertility and respiratory tract disorders.
Mm.
Is there any? If there is any question and answers, I can reply to you.
Mhm. So, sir, you have explained so nicely about back pain and heel pain. So, sir, if because these things, because ordinary people don't know much about points, and
Of course.
that's why if they want to contact to you, how they will able to contact to you? Whether you provide online service also.
As an acupuncturist, online service is wasted.
Mhm.
So because we are treatment based,
Yeah.
offline is best. If at all, if offline is not possible, in some cases we can give online. Only we can say points, but they may not be doing the correct. They may not able to select the correct point what we say, and also they may not be able to give pressure on what we intend to give. So then there will be failure in the treatment arena. So we
Mhm.
can tell, but failure will be there. But offline treatment is always good.
Yeah. So, sir,
With
how
respect.
the person, the viewer will contact to you?
What else, sir?
So, if someone wants to contact to you, so how they will able to contact? What's your contact detail? Whether
They can contact through my WhatsApp number
okay.
nine eight
Yeah,
four
I will
two.
share your number, sir, or my description box. So
Yes,
I can contact to you from there. So you give online, offline treatment in Pondicherry only, right,
yes,
sir?
of course.
Yeah.
Only in Pondicherry offline treatment.
Okay.
I'm not going anywhere elsewhere.
Mm-hmm. Okay,
Only
sir.
in Pondicherry
Mm.
on all days except Sunday.
Yeah. So, sir, we want you to come to next time also for Siddha medicine. We want to know something about Siddha medicine too. So,
Sure.
yeah.
Sure, definitely you can tell me in what area you want, so we can tell you the
Yeah.
basic things of Siddha.
Mm-hmm. Okay,
It's a
sir.
very good, it's a very good system of medicine by saints Tirumular, Agastya, Karura, Dogar, Pulipani.
Mm-hmm.
Many saints are there, and we have many form of treatments. 32 internal treatments and 32 external therapies are there. So some of the therapies are being rejuvenated or rediscovering. So we are
Mm-hmm.
rejuvenating those treatment arenas.
Mm-hmm. So, sir, it was nice talking to you. Thanks for your
Yes.
time, sir.
Thank you, sir. Thank you for your opportunity for giving me. Thank you, sir.
Thank you, sir.